Hello people, in this video we want to look at the differences between screening test and diagnostic test. So screening test and diagnostic test. So let us look at the differences. Screening test is done on apparently healthy people. So these are normal healthy people and you are checking healthy people for a disease. So this is applied to groups. This is done on apparently healthy people. The tests are arbitrary. So tests can be coming as positive or negative, but it is not, it is arbitrary, okay? And it's less accurate, it is less expensive, so you can do it on many people, right? Less accurate, less expensive. It is not the basis for treatment because it is an arbitrary test. You have not confirmed yet whether the person actually has the disease, right? Then, based on one criterion or cutoff point, just on one criteria, they are trying to find out whether there's a possibility of a disease, right? It does not have a wholesome clinical features, etc. So just on one criteria, they are trying to find out whether this person could have a disease. It is the initiative comes from the investigator or agency providing care. So this is not from the people. It looks like the initiative is coming from the investigator or agency which is providing care. Okay. Then coming to diagnostic test, guys. Diagnostic test is people who are having sickness. So they were starting off with red. These people have indications of sickness. They are not healthy people. These people are having symptoms, okay? Or they could be these people who are coming from here, right? Who are absolutely healthy, but the screening test became positive for them. So they also can be there. Then it can be applied to single patients or diseases, right? You can check one person for a disease, right? For a particular disease, you will check for one person. It is not a group kind of a thing in diagnostic test, okay? How's it going, people? What are we looking at? Diagnostic test, screening test versus diagnostic test. Currently, we are looking at diagnostic test, okay? So what are they saying here? You start off with people who have indication of sickness or people who came positive from the screening test. You pick those people and then to these individuals, you check whether they have the disease. So this diagnosis is the sum of all evidence. So diagnosis is not just a lab report. They should have clinical features or they should have a perfect lab report. It is together with a lot of things that a diagnosis is come to, right? You have to come to a diagnosis after considering a lot of things. So here number of symptoms, signs and the laboratory findings together they want to put it and they want to come up with a diagnosis. So this becomes a basis for treatment, okay? This is more accurate. Main thing you have to focus here is more accurate. A screening test may come positive, may come negative. Some people who have the disease also may get negative. But some people who don't have the disease also can get positive. But usually 90% screening test is correct, okay? So that will be specificities and sensitivity. All that you remember we have studied in screening test. Remember guys, in screening test we have how do you measure whether it's a good test? Sensitivity, that's true positives, specificity, true negatives. So this will give you how good the screening test is, but it is not 100% accurate, right? So that is about screening test. When it comes to diagnostic test, it is more accurate, it is more expensive, it is used as a basis for treatment, and it comes when the patient, this is initiated when the patient himself approaches, right, that he has the symptoms. Here also the person can be green and red. He might finally be diagnosed with the disease or he might be not diagnosed with the disease. It can happen both ways, okay? So this screening test can also be, done on people who have some high risk factors or, they may have some mild symptoms also. Give some examples of screening test, guys. Come on. You will screen people for tuberculosis, for cataract, right? Infancy, in childhood, what do you want to screen people for? In childhood, you want to screen for visual defects, right? You want to check for hypothyroidism. Then you want to check for sickle cell anemia, any hearing defect and all. When the baby is born, right? They will check for hearing, for vision. They will check hypothyroidism. They will check for congenital heart disease. Then what and all they will check for? Low LCB. What is LCB? Okay, what else, guys? You can check in pregnancy for what and all. In pregnancy, you will screen a pregnant woman for what? You can check her for anemia, for hypertension, right? So that she doesn't go into eclampsia. So you will check preeclampsia, you will check RH whether she's positive or negative, right? You can check her for syphilis, for HIV you can check her for diabetes, you can check her for cardiovascular disease, you can check for possible neural tube defects if there is a possibility, Down syndrome, all that for the baby actually, neural tube defects and Down syndrome, you will screen. A pregnant woman undergoes so many tests, right? So you will check for neural tube defects and Down syndrome in the fetus. The fetus you will check for these two in a pregnant woman, okay? Then, what else do you think? Let's talk about a normal person like you, okay? You are a middle-aged person, man or a woman. What do you want to be screened for? You can be screened for hypertension, cancer, diabetes mellitus, cholesterol. Cholesterol is a good one. People get all this checked. Obesity, right? So all this you can get checked for. You can get checked for what? Hypertension, cancer, diabetes mellitus, serum cholesterol, obesity, etc. Guys, when it comes to screening, where do you think, which level of prevention is it? Because the disease would have already occurred, so definitely it is not primary prevention, okay? It will come in secondary prevention. So you want to do early diagnosis and treatment. That's why you will do a screening test and then you will go for a diagnostic test. So it is a secondary prevention, remember. If I'm not wrong, both of these are secondary prevention. Disease may have occurred and you want to catch it early diagnosis and treatment. See, what will be a screening test for tuberculosis, guys? Cough more than 2 weeks and night sweating, all that, right? Diagnostic will be that CB-NAT, right? CB-NAT. And then you have sputum smear, chest X-ray. You'll do that Zeal-Nielsen stain. All that will become diagnostic. They will definitely prove that the person has tuberculosis or not. Similarly, guys, so many examples we can give. Okay, what about pap smear for cervical cancer? That could be a screening test, isn't it? Pap smear for cervical cancer. So, guys, this is about screening versus diagnostic test. Did you exactly understand the concept? Screening is basically not so accurate. It is done on groups of people, right, who may or may not show the symptoms. They could be high-risk people, right, and these are apparently healthy people, you can say. And once a person shows symptoms or if a screening test is positive, you can run a diagnostic check on them. This will be more accurate and you can decide whether the person has the disease or not based on his clinical presentation and also the lab diagnosis. And you can make it as a basis for your treatment. The diagnostic test will be the basis for the treatment, okay? So that's all for now, guys, in this video. We'll meet you in the next video. Bye-bye. Guys, look at some examples of screening test and diagnostic test. Like for TB, we told you, right? Greater than 2 week cough, and diagnostic will be Zeal-Nielsen stain, acid-fast staining. Now, for syphilis, guys, there is something called as rapid plasma reagin. And you have for diagnosis, you have FTA-ABS, that is fluorescein treponemal antibody absorption test. This is a treponemal test, so that is why it is more specific, right? So it's a diagnostic test for syphilis. Anyway, syphilis now much we don't have. Malaria, whoever has fever, you can screen them for malaria. And then if you, in diagnosis, you'll have to take their blood and you have to smear it and check, right? Peripheral blood smear for the parasite you'll have to check, right? You'll have to check them for the parasite, malarial parasite, right? In the blood, you will be able to see the parasite. Then coming to leprosy, if it is hypoanesthesia, then you will have to do clinical examination to check, right? For this also you can do acid-fast staining and all, right? HIV, you can do ELISA, and for diagnosis you can do Western blot assay. For breast cancer, breast carcinoma, you can do mammography, MRI, etc., palpation by physician, breast self-examination, etc. Diagnostics test for all cancer standard, it will be biopsy, okay, FNAC biopsy, something like that. Cervical cancer also you can see. For screening, you have visual check with acetic acid or pap smear, and diagnostic will be colposcopic punch biopsy. See, here you have biopsy. Usually all wherever you have carcinoma, right, you will have biopsy, okay. That will be the diagnostic test. Then coming to diabetes, guys, very important, right? Diabetes, at least you remember, okay. Random blood sugar, they will check you whenever you know these people who have these machines where they check their random blood sugar. That will be a screening test, but a diagnostic will be a fasting blood sugar greater than 126 milligram per deciliter, or an oral glucose tolerance test greater than 200 milligram per deciliter, or a HbA1c, that is hemoglobin, glycosylated hemoglobin greater than 6.5%. These three are very important for you. It will come in almost all situations in medicine, everywhere, okay. So So remember these values if you can. So these are the examples for screening and diagnostic tests for various diseases. That's all for now. Bye bye. Sorry guys, just one more point. Okay, in screening test you will get lead time. Lead time means, see, normal diagnosis you would have done at some, see, this is the natural history of the disease. At some point you might have caught the disease, right? You will catch the disease at this point, let us say. But a screening will give you, you'll be able to catch the disease earlier. So this much will be the lead time. Okay, so lead time will lead to better prognosis of the disease. Look at this one. This is usual time of diagnosis, and you are screening between these two. First possible point of diagnosis looks like final critical diagnosis something. So this is screening time. So it gives you this much of lead time. So before the usual time of diagnosis, if you catch it, it is the lead time. Okay.